Let's start our today's topic. So, today we are going to discuss about autosomal chromosomal disorders. Among these autosomal chromosomal disorders, we are first going to discuss about Down syndrome. This Down syndrome, it was first reported by John Langdon Down in 1866. Down syndrome, it was first reported by John Langdon Down in 1866. So, for that reason, it is known as Down syndrome. However, the cause of this Down syndrome, it was worked out by Jerome Lejeune in 1959. Jerome Lejeune in 1959 found that this Down syndrome, it is caused due to trisomy of chromosome number 21st. So it was Jerome Lejeune who identified that this Down syndrome, it is caused due to trisomy of chromosome number 21st. So what are the markers of the disease? What are the physical appearances by which we can diagnose a Down syndrome patient? So those markers of the disease which are present in a patient, they are known as stigmata. Stigmata or markers of the disease. Markers of the disease. So the characters which are present in a Down syndrome person, by which we can identify, are known as stigmata or markers of the disease. So these Down syndrome persons, they are easily recognized by epicanthic skin fold. Epicanthic skin fold. So they have got a fold of skin present over the canthus of the eye. So this inner corner of the eye, inner corner of the eye, this inner corner of the eye, it is known as canthus. It is known as canthus. And over this canthus, they have got a skin fold which covers the eye like this. So this skin fold covers the eye like this. So this skin fold which covers the eye like this. This skin fold is known as epicanthic skin fold. This is known as epicanthic skin fold, right? So the first physical feature of these Down syndrome patients is epicanthic skin fold. So there is a fold of skin which covers the inner corner of the eye. Inner corner of the eye is known as canthus, and the skin fold is present over the canthus. That is why we call it as epi. Epi means above, canthus means canthus. So it is present over the canthus, over the inner corner of the eye. So this is the characteristic feature of Down syndrome, right? Then they are also characterized by presence of some spots on the iris. They may have grayish spots on the iris. These grayish spots on the iris, they are known as brush field spots. Brush field spots on iris. So on the iris of eye, they have got those brush field spots. These brush field spots, that they are the second diagnostic feature of the Down syndrome patients, right? They also suffer from strabismus. They also show strabismus. What is strabismus? Two eyes do not move in tandem. Two eyes do not move in tandem. So eyes do not make the movements together. So this may result in a second. It may result in a second. When the eyes are not moving together, then that may result in a secant. You know this secant, it may be convergent secant, or it may be divergent secant. In convergent secant, two eyes seem to be looking at one point. The two eyes move together. The two eyes are bent inwards towards the nose together, right? So that is known as convergent secant. In divergent secant, one eye seems to be looking at one object and another eye seems to be looking at some other object. So we may call it as looking to London, talking to Tokyo, because one eye seems to be focused at one object and another eye seems to be focused on some other object. That is known as looking to London, talking to Tokyo. So that looking to London, talking to Tokyo condition is a divergent secant. And convergent secant is when the two eyes are both inwardly directed towards the nose, right? So this non-random, non-tandem movement of eyes, this is known as strabismus. So they may suffer, they may show epicanthic skin fold, they may show brush folds, brush field spots on iris. They may be suffering from strabismus. The two eyes are not moving in tandem. They may suffer from convergent secant or they may suffer from divergent secant, right? They have got a flat nasal bridge. They are characterized by a flat nasal bridge. Flat nasal bridge. The nose seems to be flattened. The nose seems to be small and flattened. Only nostrils are prominent. This nasal bridge, it is not raised. It is flat, right? So that is another feature. They have got small oral cavity. Small oral cavity. Their oral cavity is small. In this small oral cavity, they have macroglossa. Macroglossa. Macroglossa means enlarged tongue. Enlarged tongue. So oral cavity is small. Tongue is enlarged. So what will be the result? Tongue is not accommodated in the mouth. And tongue always protrudes, protrudes out of the mouth. Out of the mouth. So they have got small oral cavity. Their oral cavity is small, reduced. In that oral cavity, they have got macroglossa. Tongue is enlarged. So this enlarged tongue cannot be accommodated within that small mouth. So tongue always bulges out like this. Tongue is not accommodated in the mouth. So tongue always remains outside the mouth. And their mouth remains permanently open like this. Right? It is because of the macroglossa and small oral cavity. They have got microgenia. They may show microgenia. Small chin. They may also show microgenia. Small chin, a very reduced, a very little chin. They have got rounded face. Rounded face. Chan samukda. Rounded face. Right? They have got a large head. Head seems to be larger, proportionately larger. Right? So large head, rounded face, small chin. They are their diagnostic features. They have got a short neck. They have got a short neck. The neck in Down syndrome patients is very much reduced. It is very short, right? They are also characterized by single palmar crease. Single palmar crease. In their hands, they have fluffy hands. Single palmar crease. So they have got a single crease in their palm. They have got a single crease in the palm. They don't show many lines in the palm. They have got a single fold in the palm. Their hands are fluffy. So these fluffy hands, they show a single line, single crease in the middle. So that is known as single palm crease. They have got increased space between their large toe and the second toe. There is increased space between large toe, or we call it as great toe, and the second toe. There is increased space between large toe and the second toe, right? This is another feature of these Down syndrome persons, right? So these are some markers of the disease. These are some stigmata, the prominent features of the disease. So the first prominent feature of the disease is they have got epicanthic skin fold. They may show brush. They may have brush-filled spots on iris. They may suffer from strabismus. Two eyes are not moving in tandem. They may have a convergent skin. They may have a divergent skin. They have got a flat nasal bridge. They have got a small oral cavity. In that small oral cavity, they have macroglossa, enlarged tongue. So this enlarged tongue cannot be accommodated within that small oral cavity. So tongue always bulges out of the mouth. So tongue always keeps hanging, protruding out of the mouth, and their mouth remains always open with the tongue protruding out. They have got a small chin. They have got a rounded face, and they have got a large head. Large head. They have got short neck. They have got fluffy hands and feet. In the hands, they have got a single palmar crease. There is a single crease, single line passing right across the palm. That is why we call it a single palmar crease. And they have got increased space between their large toe, great toe, and the second toe. Right. So these are some prominent features of the Down syndrome patients. Right. Do these Down syndrome patients have any complications in addition to these physical markers of the disease? Do they suffer from any complications? Yes. They have got lower IQ. They have got a lower IQ. So their intelligence quotient is low. They have got a lower IQ. Their intelligence quotient is low. Sometimes 50 to 70. When it is 50 to 70, with the help of some support, they may live an independent life. But mostly their intelligence quotient remains in between 30 to 50. When the intelligence quotient is 30 to 50, under this condition, they are not able to live an independent life. So they depend upon other person. So they show some sort of mental retardation, right? But when the intelligence quotient is 50 to 70, with the help of support, then they are able to live some sort of independent life, right? So one problem is their low IQ. Number second, they have got some degree of mental retardation, as I told you. In addition to that, these Down syndrome patients, they suffer from heart problems. They suffer from heart problems. They may have atrioventricular or ventricular septal defects. They may have atrioventricular or ventricular septal defects. So their atria and ventricles, they are malformed, or the septum, AV septum is malformed, or ventricular septum, interventricular septum, that is malformed. So they have some heart problems. The incidence of blood cancer is 50 times higher in Down syndrome patients. Incidence of blood cancer, leukemia, is 50 times more in DS patients, Down syndrome patients. So they are more likely to suffer from blood cancer. They also suffer from hypothyroidism. They are at increased risk of developing hypothyroidism. They also suffer from gastrointestinal disorders. Gastrointestinal disorders. They mostly suffer from the disorders of alimentary canal. They have problems with digestion, they have problems with digestion, etc. Right? Males usually become sterile because of defects in spermatogenesis. Females also have got problems in their fertility and in their menstrual cycle, right? So these are some complications which are associated with this Down syndrome. The external features of the disease, they are not creating any problem. We may take them as usual, right? But they have some complications. The first complication is with their IQ. They have low IQ. Because of that low IQ, they are not able mostly to live independent life. They need some support. Then they have got heart problems. They mostly suffer from atrioventricular septal defects or ventricular septal defects. They have got more chances of having blood cancer. Incidence of blood cancer is 50 times higher, more in Down syndrome patients. So most of these Down syndrome patients, they may suffer from blood cancer. They also have got higher risk of hypothyroidism. So they also suffer from thyroid problems. So they mostly suffer from hypothyroidism. They also suffer from gastrointestinal disorders. The disorders of alimentary canal, malfunctioning of alimentary canal is very common in these Down syndrome patients. Males usually become sterile. Males usually become infertile because of defects in spermatogenesis. Similarly, females also have got problem. Female Down syndrome patients, they have got problem in their fertility. They may show menstrual irregularity. They may show ovarian irregularity. They may show premature this labor, right? So they mostly become infertile. So these are the complications associated with this Down syndrome. So how does their karyotype look like? If we see the karyotype of these Down syndrome patients, if we subject them to karyotyping, we will find there may be